Greetings, everyone, and a warm welcome. In this video lecture, I will be discuss the types of counseling directive, non-directive, and eclectic. Let us try to understand various types of counseling. Counseling is a therapeutic process where individuals seek professional assistance to explore and address personal challenges, emotions, and behaviors. The choice between directive, non-directive, or eclectic counseling often depends on the client's preferences, the nature of the issues being addressed, and the counselor's expertise. Some clients may benefit from a more structured and solution-focused approach, while others may thrive in a client-centered, exploratory environment. Different approaches or styles of counseling exist, and three common types are directive, non-directive, and eclectic counseling. First type of counseling is directive counseling. Directive counseling is a therapeutic approach in which the counselor takes an active role in guiding and structuring the counseling process. This style of counseling is often characterized by its focus on providing practical solutions, advice, and specific interventions to help clients address and resolve their issues. The counselor, in this approach, assumes a more instructive and goal-oriented role. Characteristics of directive counseling: 1. Structured and goal-oriented. Directive counseling is typically more structured with clearly defined goals. The counselor and client work collaboratively to achieve specific outcomes within a predetermined time frame. 2. Problem-solving focus. The primary emphasis is on problem-solving. The counselor actively assists the client in identifying, understanding, and resolving specific issues or challenges they are facing. 3. Active counselor involvement. The counselor takes a proactive role in the counseling sessions, providing guidance, suggesting strategies, and offering specific interventions to help the client make progress. 4. Psychoeducation. Psychoeducational components are often integrated, where the counselor educates the client about various coping skills, strategies, and techniques to manage their difficulties effectively. Examples of directive counseling approaches. 1. Cognitive behavioral therapy. CBT is a directive therapeutic approach that focuses on identifying and changing negative thought patterns and behaviors. The counselor actively collaborates with the client to develop and implement practical strategies for changing unhealthy cognitive patterns. 2. Solution-focused brief therapy. SFBT is a goal-oriented approach that emphasizes finding solutions to current problems rather than delving extensively into the past. The counselor assists the client in identifying and building on their strengths to achieve specific, measurable goals. 3. Behavioral therapy. Behavioral therapy, including approaches like applied behavior analysis, ABA, involves direct and systematic interventions to modify specific behaviors. This can be particularly effective in addressing behavioral issues and conditions. 4. Directive career counseling. In career counseling, a directive approach might involve the counselor providing specific guidance on job search strategies, resume building, and interview techniques. The counselor takes an active role in assisting the client in making career-related decisions. 5. Problem-solving therapy. This directive approach focuses on enhancing problem-solving skills. The counselor helps the client identify problems, generate potential solutions, and implement effective strategies to address challenges. Second type of counseling is non-directive counseling. Non-directive counseling, also known as client-centered or person-centered counseling, is an approach that emphasizes the importance of the client's autonomy and self-exploration. Developed by Carl Rogers, this therapeutic style is characterized by a non-judgmental and empathetic environment in which clients are encouraged to explore their feelings, thoughts, and experiences freely. The counselor takes a supportive role, actively listening without imposing judgments or solutions. Characteristics of non-directive counseling. 1. Client-centered approach. The counseling process revolves around the client's unique experience and perspective. The counselor respects the client's autonomy and allows them to set the agenda for the sessions. 2. Active listening. Active listening is a fundamental aspect of non-directive counseling. The counselor provides genuine attention and empathy, creating a safe space for the client to express themselves openly. 3. Reflection and clarification. The counselor reflects the client's feelings and thoughts, helping the client gain insight into their own experiences. Clarification is used to explore and deepen the client's understanding. 4. Unconditional positive regard. The counselor maintains an attitude of unconditional positive regard, accepting the client without judgment. This creates an atmosphere where the client feels valued and accepted. Examples of non-directive counseling approaches. 1. Person-centered therapy. Developed by Carl Rogers, person-centered therapy is a foundational model for non-directive counseling. It focuses on creating a supportive therapeutic relationship, emphasizing empathy, congruence, and unconditional positive regard. 2. Narrative therapy. Narrative therapy is a non-directive approach that explores the stories individuals tell about their lives. The counselor collaborates with the client to reframe and reconstruct narratives in a way that empowers positive change. 3. Existential therapy. Existential therapy encourages individuals to explore and make meaning of their existence. The counselor assists clients in examining their values, choices, and responsibilities in a non-judgmental manner. 4. Gestalt therapy. Gestalt therapy involves experiential and present-focused exploration. The counselor facilitates awareness of the client's thoughts, feelings, and behaviors without imposing interpretations. Third type of counseling is eclectic counseling. Eclectic counseling is an integrative approach that combines techniques and strategies from various counseling theories and therapeutic modalities. The term eclectic signifies the blending of different elements to create a customized and flexible therapeutic intervention. This approach allows counselors to draw from diverse theoretical frameworks based on the unique needs and preferences of the client. Characteristics of eclectic counseling. 1. Integration of approaches. Eclectic counselors integrate interventions and techniques from different counseling theories, combining elements that are most suitable for addressing the specific concerns of each client. 2. Tailored to client needs. The eclectic approach is highly adaptable. Counselors tailor their interventions to the individual needs, preferences, and goals of the client. 3. Holistic perspective. Eclectic counseling aims to provide a comprehensive and holistic treatment by considering various aspects of an individual's experience, including thoughts, emotions, behaviors, and relationships. 4. Flexibility in application. Counselors using an eclectic approach have the flexibility to switch between therapeutic techniques as needed during the counseling process. This adaptability enhances the effectiveness of the intervention. Examples of eclectic counseling approaches. 1. Integrative psychotherapy. Integrative psychotherapy involves blending elements from different therapeutic approaches, such as psychodynamic, behavioral, cognitive, and humanistic, to create a more comprehensive and tailored treatment plan. 2. Cognitive behavioral therapy, CBT. Integration. Counselors may integrate specific cognitive behavioral techniques, such as cognitive restructuring or behavioral exposure, into a broader eclectic framework to address cognitive and behavioral aspects simultaneously. 3. Dialectical behavior therapy, DBT. Integration, DBT, which combines cognitive behavioral techniques with mindfulness and acceptance strategies, might be integrated eclectically to address emotional dysregulation and interpersonal challenges. 4. Mindfulness-based interventions. Techniques from mindfulness-based approaches, such as mindfulness-based stress reduction, MBSR, or mindfulness-based cognitive therapy, MBCT, can be integrated into eclectic counseling for stress reduction and emotional well-being. 5. Family systems approach integration. An eclectic counselor might incorporate family systems concepts, and interventions to address relational dynamics and systemic factors affecting an individual or family. Thank you, everyone. If you're passionate about education and teacher training, consider subscribing to my YouTube channel Education and Teacher Education at Shokeen Bilal.